It's been another very positive and very practical meeting of the National Cabinet. There will be a statement issued later that will go into much more detail, but would note the key items that were discussed today. And I'll ask both Professor Kelly, as is usual, to run through the key items from an epidemiological point of view, and it was briefed to National Cabinet today. But I'll also ask Dr Finkel to speak on what was one of the key matters that was dealt with today. And that was the National Contact Tracing Review, which we received today from Dr Finkel. And I want to thank Dr Finkel, as well as Lee Jasper, a digital technology and delivery expert, very successful professionally in that area, commercially, and Dr Taryn Wiramanthri, a public health expert for many years, was the WA Chief Medical Officer, and the three of them have worked together to do an exhaustive review of the contact tracing system in each state and territory, and making recommendations and observing the improvements that have been made there. And there's a set of recommendations, all of which have been adopted by the National Cabinet today to take forward. So I thank Dr Finkel for that, and he can take you through those recommendations in more detail. Also today, the national vaccination policy of the Commonwealth was endorsed by the National Cabinet today. Not just noted, they were keen to endorse it as well. And that's another sign that together as a country we are working to prepare ourselves to be able to disseminate and administer those vaccines all around the country when they're ready, when they have passed the necessary TGA approvals to ensure that they are safe. Once we have cleared those important benchmarks, then we must be in a position to be able to disseminate and administer those all around the country. And of course that requires the usual support of states and territories and how that's done. And Professor Kelly, who is the Deputy Chair of the advising group to the Commonwealth on our national vaccination policy and strategy, will be able to update you on that policy, and that will also be released today together with this document as well. The framework for national reopening, when we met last time, we were able to adopt that in principle, but we had two jurisdictions that were still in caretaker mode. So the plan that I outlined at our last meeting and that we spoke of here after the last meeting has now been agreed, with the one exception of Western Australia, which I've already flagged. That is a plan to have Australia open by Christmas, with the exception of Western Australia. It also is a plan that importantly embeds public health metrics in ensuring that when Australia opens safely, that it remains open safely. And that's incredibly important. The things that need to happen, and importantly the work of Dr Finkel's contact tracing review, which also identifies additional metrics that are needed to make sure that we are always aware that we are staying on track and have the protections in place to keep Australia open. Other matters dealt with today, of course, is getting Australians home. This remains a very, very significant challenge. And while we will see some 25,000 odd Australians return to Australia since I first spoke of this some weeks ago, if not months, the number of Australians coming onto that list, as you know, has been growing every day, every week, including the number of vulnerable Australians. We're getting vulnerable Australians home. We're getting thousands of Australians home. We've today increased 150 additional places coming out of Queensland. We thank them for that. We have additional capacity, as I announced last week when I was in Tasmania. We've got additional capacity where we're signed up to in ACT and the Northern Territory. But the challenge is still greater than the capacity to receive people back into quarantine. Now, obviously, Australia is going to maintain its quarantine arrangements for people returning overseas. National Cabinet and the Commonwealth Government is very committed to that. This has been one of Australia's great successes. And as I was discussing yesterday with President-elect Biden, was one of the reasons why Australia has been so successful, is we've put these strong measures in place. And I should have mentioned that a copy of this National Contact Tracing Review, as a result of the discussion I had with President-elect Biden yesterday, I'll be forwarding to their team because it tells the story of why Australia is being successful and will continue to be successful. We'll, of course, copy that to the US administration as well. But given President-elect Biden's interest in this issue and the people he's bringing together there, he was very keen to know what we were doing. And I'm sure, while not able to get on a plane and go there, Dr Finkel and his colleagues would be available to assist whoever, wherever they are, in whatever country, to learn from Australia's experience.